Hello everybody, I'm Dr. Vikram Mhaskar, a knee and shoulder surgeon from New Delhi, India, and welcome to another video. In this video, we're going to be talking about knee ligaments. Did you just trip? Did your knee just twist? Did you have swelling? Did you have pain? Could you not put weight? Did you feel like your knee was a little wobbly? You may have had a ligament injury. Firstly, what are ligaments? Ligaments are ropes that connect two bones together. Your knee is made up of three bones: the thigh bone, the leg bone, and the kneecap. The thigh bone and the leg bone, where they meet, is the tibiofemoral joint. It's made to take weight and help in movement. The kneecap sits on the thigh bone. The kneecap is convex. The thigh bone is concave. It's mainly a joint that acts as a lever. It gives you the mechanical advantage to jump, run, get up from a seated position, etc. Ligaments that keep the thigh bone and leg bone together, which are inside the knee joint, are called the cruciate ligaments. There are two types: the ACL, the anterior cruciate ligament, which is in front; the PCL, the posterior cruciate ligament, which is at the back. So let me show you that. Here is the ACL in front, here is the PCL at the back. There are two other ligaments outside the knee. These are called extra-articular ligaments. The one on the inside is called the MCL, the one on the outside is called the LCL. MCL means medial collateral ligament and LCL means lateral collateral ligament. So what do? The ACL and the PCL prevent the knee from going front and back. MCL and the LCL prevent the knee from opening inwards and outwards, right? These ligaments can break. How do they break? They normally break with sporting injuries. You could slip and fall, or very commonly in India, a fall from a two-wheeler, right? When they break, what do? They render the knee unstable. How would you make out? There'd be a lot of pain, there'd be a lot of swelling, you may not be able to put weight on that particular part, and when you try to put weight, you feel wobbly. That means you try to stand up, you fell down again. Most likely, this is an injury. Injury can be graded. It could be either a tear or it could be a sprain. What is a tear? So ligaments are like ropes, and ropes are made up of smaller ropes which are intertwined and they have a covering around them. Now all the ropes, smaller ropes may tear, then we call it a ligament tear, or 25% may tear, 30% may tear, then we call it a sprain, or the rope may get excessively stretched, even then we call it a sprain. So a ligament tear is an extreme form of injury, the sprain is a lesser form of injury. Even the symptoms of what you feel are lesser in a sprain and more in a tear. How do you diagnose it? So it's best diagnosed by a specialist. A specialist is a doctor that specializes in that particular joint. Like me, I'm a knee surgeon. When you see the specialist, he first sees you, he asks you some questions, and then he examines you. He sees whether that particular bone can be pulled more than its location, right? There's certain special tests when it can be put more than where it should actually be, means that ligament is not doing its job. Once he does that, he may order certain investigations like an MRI. The MRI is a best investigation to know whether you have a ligament injury or no. Once that's done, he will let you know what you need. Certain ligaments heal better, the ones outside the joint, like the MCL and LCL. So you may just need physiotherapy, etc. If it's along with a cruciate ligament, that is an ACL, PCL, or it's a higher degree tear, then you may require surgery. Surgery is essentially of two types. You either repair the ligament or you reconstruct the ligament, right? What is the difference? Repair is just fixing them together. Then acute injuries, they're injuries where the ligament has come out from one bone. So it's like a clothesline. Clothesline can break in the middle, it can break from one wall or the other wall. When it breaks from one wall, you can fix it back. So then you fix it back. It's called a repair. When it's broken in the middle, then you need a new clothesline. So that's called a reconstruction. Reconstruction also is of two types. There are certain spare parts in your body like the hamstring tendon, etc., which can be used and new ligaments can be made. However, there's the latest technology of using artificial ligaments, which are very successful, and I use them routinely. They are made in a laboratory, much faster recovery, and they're also very successful. But both are great. Long-term follow-ups of both are the same. Apart from an operation, you would require some element of physiotherapy after this, which is exercises which are for strengthening your thigh muscles so that they can compensate for the ligament and later on assist the ligament in its activities. I hope you've understood quite a bit about knee ligaments, basics about how could you recognize them, how are they diagnosed, and what's the treatment. Remember, most of these treatments are through keyhole surgery. That means only through small little holes. They're called arthroscopic surgery. If you liked my video, please like and subscribe to my channel, and please follow me on Instagram. Thank you.